Hi, I'm Joshua Hunter, Medicare Specialist on staff at McGinnis Elder Care Law. In this video, I'm going to explain the difference in original Medicare and Medicare Advantage plans. We've all seen the commercials, mail-outs, and marketing tools used by the various companies associated with Medicare, but they don't answer the most important question. How are all these options different and how do they affect me? I like to look at this choice as picking which path you want to travel. When you first enroll in Medicare, you're given a chance to choose between original Medicare and Medicare Advantage, and both paths have their own things to consider. I'm going to start by talking about original Medicare. If you choose to go down this path, you need to understand how it works and the choices you need to make to have the best coverage. Original Medicare consists of Medicare Part A and Part B. Medicare Part A is the hospital insurance that covers 80% of the cost for inpatient procedures. Medicare Part B is the medical insurance that covers 80% of the cost for outpatient procedures. Technically, this is all you must have for original Medicare, but you'll need to fill the gaps. Medicare Part D is the prescription coverage option for medications. D is for drugs. If you are on original Medicare, you'll have to pick up your drug coverage and it will come from a third party that contracts with Medicare. Some examples could be Humana, Aetna, or Express Scripts. I'm sure that you noticed I said Medicare Part A and B only cover 80% of the costs. You have the option to pay for the remaining 20% out of pocket, but most people choose to pick up a supplement plan. This is sometimes called a Medigap policy. Similarly to Part D, you have to pick your supplement plan and it will come from a third party that contracts with Medicare. Some examples could be Farm Bureau, AARP, or Mutual of Omaha. Now you know all the pieces that make up the original Medicare path. If you choose the Medicare Advantage path, there are different things to consider. Unlike original Medicare, a Medicare Advantage plan is not made up of separate parts. Medicare Advantage is an all-in-one alternative to original Medicare. These plans work through companies that contract with Medicare and they provide the coverage. The Medicare Advantage path might sound far simpler on the front end, but it has its own unique considerations. In most cases, you will need to use the doctors who are in the plan's network. If you see a doctor who is out of network, your out-of-pocket costs will seriously increase. You would want to be sure that your favorite doctors and providers were covered by the plan before you choose to enroll. There are also different types of Medicare Advantage plans. For this video, I'll go over the two most common, HMO versus PPO. When you see a plan with the letters HMO beside the plan name, that means Health Maintenance Organization. To get straight to the point, these plans typically have a larger network and include more doctors and providers, but they require referrals for specialty care. On the other hand, PPO stands for Preferred Provider Organization. These plans typically have smaller networks, but you do not need a referral for specialty care. On a different note, since a Medicare Advantage plan is a bundle of services, you'll also want to make sure the plan covers your medications. You cannot pick up a separate plan to cover your prescriptions. Now you know the things to consider on the Medicare Advantage path. Since both the original Medicare path and the Medicare Advantage path can be so difficult to understand and navigate, I highly recommend you use a professional to help you find the most cost-effective option.